19 minutes in front of the top of the hour, and so the ongoing bird flu epidemic poses really a serious threat, not just to agriculture, but also to public health and the economy. As you know, egg prices, a household essential, just skyrocketing and really going up and down, fluctuating. Even more alarming, the virus has begun to infect humans, with 67 cases reported in the U.S. and the first human death recorded last week. Experts warn that if the virus evolves to spread between people, it could trigger another global pandemic.
For more on the bird flu epidemic, let's welcome in former CDC Director and Senior Fellow for Biosecurity and Public Health Policy at the Heritage Foundation, Dr. Robert Redfield. Doctor, good morning to you. So given that every state is currently impacted by the bird flu, with its reach now extending to cattle and the first human death reported just last month, how concerned should the public be about this potential spread of the virus?
Well, I think they should be concerned in the sense that they should want our nation to get better prepared for this pandemic. I'm of the view that we will, unfortunately, eventually have a significant bird flu pandemic. Right now, it's a major agricultural issue. You may know in 2019, when it came into our birds, as you mentioned, it's already now in well over 100 million birds. It's in over almost 500 species of birds. It's causing significant death among birds, transmits very well among birds. But it's also gone from bird to mammal. We're in about 48 mammal species now in the United States, including dolphins and seals and bobcats and cats, a variety of different animals. The only issue is it doesn't know how to go mammal to mammal. It's also in humans. As you know, we've had 67 cases in humans, and of course, recently we've had the most recent death. The real issue is how this virus changes. It's trying to learn how to go mammal to mammal. It hasn't learned how to do that outside of bird to bird. But when it does learn how to go mammal to mammal, that evolution will eventually make it more likely that it will actually be able to infect humans and then go human to human.
So if you're sitting at home listening to this, very concerned right now, obviously worried, what should you be looking for? And I want to reiterate, should you be worried about eating eggs or chicken that you may have got at the grocery store that's in your refrigerator right now?
Yeah, I think the agricultural groups are really looking at this pretty carefully. There's no evidence, for example, in milk, dairy milk, this virus is killed by pasteurization. Then people have recommended that you don't eat raw eggs, that you cook your eggs. You don't eat raw chicken, that you cook your chicken. If you do those steps, you really aren't going to have a risk from bird flu from chicken or eggs or milk. But it is going to be a big issue for agriculture. I mean, it's causing a lot of, as you know, the eggs prices are going up. The reason the egg prices are going up is that they're calling a lot of chickens because this virus is getting into chicken groups. You saw the governor of New York just closed down the poultry sales in the state of New York. So it's going to be a big agricultural issue. There's no doubt about it.
Yeah, Doctor, one thing I want to, and we've only got about 30 seconds to go, but I do want to ask you, obviously you had a very big role with the CDC during COVID, during the most recent pandemic that we've had. Do you worry that perceptions about how that was handled could impact the public's view should something like this actually make it to another pandemic level?
Yeah, that's the real cost. I mean, there's been enormous loss of public trust. There's no doubt about it. And rebuilding that public trust is critical. One of the things about public health is in order for it to work, the public's got to trust the public health leadership, and there's no question that that's been severely damaged. So my hope is that we can rebuild it, but you got to rebuild it by telling the public the truth, being transparent with the public. I'm a big advocate of Robert Kennedy. I think he's going to be a great Secretary of Health. I think one of the things that's fundamental to Kennedy is transparency transparency about vaccine safety, about transparency about what's in our food products. So I think if we're just honest with the American public and tell them what we know and what we don't know and not be afraid. I mean, I used to get criticized a lot when I was CDC director because it wasn't uncommon for me to answer a question by saying, I don't know the answer.
Yeah.
Sometimes we don't know.
Yeah.
Dr. Robert Redfield, thanks for joining us this morning.
Thank you.
Bless you.